Inappropriate urination questions are among the most common questions posed by cat owners. This condition is likely the most frustrating issue the cat owner encounters as well. So, is inappropriate urination a behavior issue or a medical condition? Are we accurate in diagnosing the cause of inappropriate urination? And are there treatments that we might not be utilizing that might truly benefit the feline with such conditions? The reason this issue is so important is that it is often difficult to distinguish true behavioral causes of inappropriate urination from pathologic causes of inappropriate urination. Mismanaging such cases could have significant implications for the feline patient. Today in the U.S., inappropriate urination is the #1 cause for relinquishing cats to shelters. One study showed that almost 25% of cats surrendered to shelters had inappropriate urination behavior. Many of these cats go on to be euthanized. In this short program, we'll provide a very brief overview of how to distinguish the behavioral causes of inappropriate urination. We'll also provide some insightful tips for managing both medical and behavioral causes of inappropriate urination. And finally, we'll look at long-term care options to consider. A new approach to managing these challenging cases will be very rewarding to both you and the pet owner, and, of course, the cat will be very appreciative, even if they don't always show it. The behaviors of cats may never be fully understood, but we've made great strides in understanding and categorizing some of the behavioral characteristics of inappropriate urinations. Behavioral reasons for inappropriate urination are generally either toileting problems and/or marking behaviors. Toileting problems refer to those cases where the cat has elected to use a site other than the litter box to evacuate its bladder or bowels. Marking behavior is generally for reasons of communication, by means of depositing urine in key locations. Diagnosing these conditions begins with a comprehensive history. These questions should target the cat's environment and social surroundings. The question should consider time of onset and progression of the condition. Asking the right questions is critical. Address the following urinary concerns: frequency of trips to the litter box, size of clumping of the litter if clumping litter is used, the color of the urine if silica litter is used or when urine is deposited on other non-absorbent surfaces. The location of urine inappropriately deposited is also important. Cats that spray urine onto vertical surfaces several inches off the ground are often urine marking. They usually expel urine in a standing position, with their back feet treading and the tail quivering. Cats that deposit urine on horizontal surfaces with social significance, for example near windows or doors or on items that have the scent of a particular person or pet, should be suspected of marking if medical causes are ruled out. Environmental issues often trigger inappropriate soiling. Dirty litter boxes, changes in litter, and the introduction of a new cat may all create a significant reason not to use the litter box. Remember that when cats deposit both urine as well as fecal material outside the litter box, this is generally associated with a litter box avoidance issue. As we mentioned at the beginning of this program, cats with medical problems such as urinary disease will often need to be managed from a medical approach as well as a behavioral approach. The reason this occurs is often referred to as classical conditioning. The cat associates the litter box with the pain that they experienced when they previously urinated in the litter box. As a result, they continue to avoid that location. In this scenario, the litter box must be modified so that it is no longer associated with the painful experience. This can be accomplished by moving the box to another location, changing the physical characteristics of the box, going from a covered box to an uncovered box or a different style litter box. A change in litter may also have a positive impact. Keep in mind also that cats with feline lower urinary tract disease often urinate more frequently. This increased soiling may create a litter box aversion secondary to a lack of cleanliness. Therefore, providing additional litter boxes or cleaning the box more often may help minimize the aversion behavior. Another consideration to keep in mind when treating these cats is that sometimes the new location or surface is more pleasant than the litter for depositing urine. Perhaps it is softer, more absorbent, or simply more accessible. Feline lower urinary tract disease and the onset of inappropriate urination is such a prevalent combination that it makes prevention of feline lower urinary tract disease an important recommendation for nearly every cat owner. Several studies have looked to identify the risk factors for feline lower urinary tract disease, and we'll point out two that have behavioral implications. The first risk factor is inactivity. Cats that lead sedentary lives in the house benefit from play and physical stimulation with the owners. Secondly, a variety of stress-related factors appear to put cats at increased risk for feline lower urinary tract disease. Predictable routines and interactions may help reduce stress in cats. Environmental enrichment may also aid in reducing stress. Perches and vertical climbing spaces are beneficial stress reducers, especially in multi-cat households. So what have we learned thus far? Distinguishing behavioral causes of inappropriate urination from medical causes is critical in effectively managing these challenging cases. A thorough history is an essential element of making the diagnosis. Many of the cases of feline lower urinary tract disease require us to consider behavioral issues along with the medical treatments we recommend. Such a multifaceted approach is essential if we expect quick resolution of inappropriate urination. Owners need to be thoroughly educated to the importance of every element of treatment and prevention. And finally, remember that these cases are often easier to manage than they are to treat. Make use of proven therapeutic foods such as the new Hills Prescription Diet CD Multi-Care Feline in conjunction with a low-stress, active feline lifestyle to help prevent recurrence of these cases. In the next program, we'll look at new approaches to treating feline lower urinary tract disease. These, combined with proper behavioral counseling, will provide rewarding results.